All right, I've just started recording the session, so yeah, just make sure everyone's mics and cameras are off. Hi everyone, my name is Steph. I work at WAAC, and I'm joined today with Sophia from Hepatitis WA. I'm just going to do a bit of an introduction and then I'll let Sophia do her presentation on the ABCs of hepatitis. So before we start, I just want to acknowledge that we are on Aboriginal land. So I'm coming to you from the land of the Whadjuk Noongar people. I believe Sophia is as well. And I just want to pay my respect to elders past and present, and also extend that respect to any Aboriginal or First Nations people joining today or watching the recording as well. Always was, always will be Aboriginal land. As I said, my name is Steph. I work in health promotion and workforce development at WAAC. I work alongside Amy, who normally does our fun little Hump Day health sessions. And today, Sophia is going to be presenting from Hepatitis WA. So I will let you introduce yourself and your presentation, Sophia. Thank you so much for joining us.
Yeah, thank you, Stephanie. Thanks for having me here and helping us bring more awareness to hepatitis. So this presentation, you can join in to vote and make it interactive. If you can just use the QR code there or go to menti.com and enter that code there. And let's give a thumbs up or something when everybody's in. Maybe you can see that better than me, Steph.
Yeah, I'll let you know how we go. I'm just logging in myself again now. All right, cool. I think I am in. I'm not sure about
Okay.
anyone else. I haven't got any comments in the chat or thumbs up, but.
Okay, just to see, here's a question just to see if this works. What are you having for lunch? Hopefully. I had a hot dog, which I don't usually do. Okay. Which might roll. Let's see if there's one more. Okay, let's move on. Okay, great. Looks like it works. Just in case you don't know about us, so we're Hepatitis WA, which, as the name suggests, we help people with hepatitis, specifically viral hepatitis, within the scope of Western Australia in WA. So we do that through various things. We do education and workshops. I do workforce development. But we also have other people that give health promotion or people that run programs in prisons, like the Hip-Hop, which is health in prison, health out of prison. We have a peer education program in prisons too. And then apart from that, we are based in Northbridge. Our offices are in Northbridge and our premises are in Northbridge. And we've got 2 doors that are open to the public. So on one side, we have the needle and syringe program where people can come in for needles and syringes and get advice on harm reduction. We provide naloxone. We provide food and hygiene supplies. And we're basically run by volunteers there. It's a pretty fun place to volunteer. And on the other side, we've got, on our other door, we have the Dean Clinic, which is a GP clinic, which is obviously kind of specialized in hepatitis. And if you ever need to refer any patients there, just be known that even though somebody might be regional, we can provide anybody within WA with telehealth when it has something to do with hepatitis. And we also help run the National Hepatitis Info Line, which is actually going through a update and a new name and a new branding soon. So that will be coming shortly. And we'll move on now. So we'll be talking about hepatitis. So an introduction to hepatitis, then the ABCs, which are hepatitis A, hepatitis B, hepatitis C. We'll touch a bit on the topic of discrimination. And then Stephanie and I will do a comparison on hepatitis and HIV. And then we'll just do a quick true or false after that. Right. So now we'll jump onto hepatitis. And here are some worldwide stats that were taken from this year's World Hepatitis Day, which was in July. There are more than 300 million people in the world living with hepatitis. And we're talking about viral hepatitis. More than 2 million cases are diagnosed every year. There are currently 1.3 million people dying of hepatitis every year. It's currently the leading cause of liver cancer. In actual fact, only 1 to 4% of people with chronic hepatitis will develop liver cancer. But if you do multiply that by 300 million, that's a lot of millions. And now, this is quite an eye-opener. It's the deadliest virus after COVID. But strangely, nobody talks about it, right? Okay, the prevalence of people living with viral hepatitis in Australia is this. So 73% of people living with viral hepatitis have hepatitis B and 27% have hepatitis C. These numbers are ever changing, they're decreasing, but the proportions keep on changing. And that's mainly due to the fact that there's a really good cure for hepatitis C now. So that number should be, continuing to decrease, and hepatitis B continues to decrease as well, but it gets broader because there isn't a cure for that yet, but there might be soon. And I haven't included hepatitis A in the pie chart because it's not really common in Australia. So it's not that it doesn't exist, it's more like a thing that people that are traveling overseas, they catch it there, and then they come back and they might be sick for a while, but then they're just going to get cured from it by themselves through the immune system. So it's not really a common thing in Australia. We don't really measure that. Let's see, oops, there we go. Okay, so what is hepatitis? You can type in your response. Inflamed liver. Yeah, so hepatitis, just that word on its own, is inflammation of the liver. It is an inflamed liver. Hepa means liver, so everything with the word hepa in medicine would refer to the liver, and titis is inflammation. So it's literally inflammation of the liver. And it can be due to lots of things, but we're going to focus today on the viruses. So it can be due to other things, like it can be alcohol-induced. So that's, for example, if you're wanting to drink, 2 or 3 bottles of alcohol a day, you might end up with alcohol-induced hepatitis, and that might turn into cirrhosis. And then there could be other factors as well. There can be other things, people that take drugs, whether they're illegal drugs or legal drugs. Lots of medicines are metabolized in your liver. So if you take them for a long time, they can produce damage in your liver. And then also, other things like your diet, your body weight, genetic conditions can give something called fatty liver, or there's something else called hemochromatosis, which is iron overload, which is when your liver stores too much iron. We all store iron in our liver, and generally we can control the amount of iron that comes in and out, but some people have a genetic condition where they can't do that. So the iron builds up in the liver, and that's going to cause another form of hepatitis. But today we're going to focus on the viruses. So when we have viral hepatitis, which is when we have hepatitis due to one of the viruses that cause hepatitis. And just before I go on, I'd like to mention as well that viral hepatitis would be the only form of hepatitis that's transmittable. All the other ones are inherent to somebody. So if, for example, somebody works in, say, food handling, and they have alcohol-induced hepatitis, or they have fatty liver or hemochromatosis, they can't pass that on. They can't contaminate the food and so on. So, nor can you with hepatitis B or C anyway. But viral hepatitis is the only one that's transmittable. And so these are the three main ones: hepatitis A, B, and C. There's a few more, E and E. B is not very common. You need to have B at the same time for it to transmit. And hepatitis E is a rare form of hepatitis that is usually found in wild boar or deer, and people that hunt these animals and don't cook the meat properly can get. So they're pretty uncommon in Australia. What they have in between them is that they use the liver as their host, meaning that they're going to live in the liver. They might hang out in the blood or in other places around the body, but it's in the liver where they're going to live, and they'll be multiplying, and then over time there'll be more and more of them, and then they will be, letting out their toxins and things like that, and then they'll cause damage to the liver, and that's how they cause inflammation of the liver. So here's another little quiz. What does the liver do? What are the functions of the liver? Any guesses? Because we all tend to think about other organs, don't we? We think about, oh yeah, it produces bile, breaks down drugs, exactly. We tend to think about other organs a lot, like our heart or our lungs or our skin, but we tend to forget about the liver, which does lots of important things. So yeah, it produces bile, which carries away wastes and fats and things. It breaks down drugs, yes, and alcohol and toxins. It produces more than 500 chemical reactions or enzymatic reactions a day. So it's really important in our digestion. It's really important in breaking down our food and into all the little, building blocks. It also produces some of our proteins and amino acids. So that's really important. It produces cholesterol, which might sound pretty strange, but about 70% of our cholesterol is actually produced in the liver. It doesn't come from our food. Only some of it comes from our food. But 70% is produced there, and it turns into, it's the precursor of some of the steroidal hormones that we need to function properly. Other things that it does is it stores iron, as I said, and it's in the liver where it puts the iron into hemoglobin to bring oxygen around the body. It helps with our blood clotting. It also helps to regulate our immune system. It breaks down ammonia. It turns ammonia into urea to be flushed away with our urine. So you can see that it does a lot of things. It eliminates fluid. So if you think about it, it's a pretty important thing. Oh, and I forgot to say as well, it's really important. It produces energy for us. That's really important. Because one of the main symptoms of hepatitis is just being tired. So the liver produces energy, and it also regulates the balance between glucose and glucagon and things like that. So you can see that if the liver doesn't function properly, there's going to be a ton of things that's not going to work properly, right? And we're going to get really sick in the long run. Okay, so this is what happens when somebody has a damaged liver, and these are the initial symptoms. So usually somebody would get really tired, and usually for a long time, that might be the only symptom, the only thing that shows. Except with hepatitis A, we'll see that in a moment. But with other forms of hepatitis, usually people would just be tired. You could have stomach cramps, and once in a while you get a headache. You just feel out of sorts. So that can go on for a lot of years. So imagine if somebody went to the doctor and said, "Oh, I'm tired. I've got brain fog. I'm a bit depressed." Just how easy is that to be diagnosed as something else, right? And that's why it's so common to hear, stories of people that say they found out they had, hepatitis 10 years later after getting it, or like it's calculated that they had it for 10 years and nobody realized, because for many years the symptoms can be extremely vague. But then as time passes by and then your liver gets more and more damaged, so say 20 years later, a bunch of other symptoms could show up. So you could get red scaly skin on the palms of your hands, and red veins on your skin, and really brittle nails with those white marks like the photos. And you could grow boobs because of that hormonal dysfunction. So this photo is of a man with chronic hepatitis. Other things would be that you'd get a swollen belly and swollen hands and feet, because if you can't eliminate toxins properly and you can't eliminate fluids properly either, you get fluid and toxin buildup, and that's how it shows. And then you would get a lot of bruising, because if you can't regulate your blood clotting properly, that's another thing. And then you would also get jaundice, which is when the skin goes yellow and the whites of the eyes also goes yellow. And people would also get a really metallic smell and itchy skin. But once again, these are common signs of hepatitis, but they don't show up until a couple of decades later. And then the natural progression of somebody that would have, it says hepatitis C here, but it's any form of hepatitis really, was that you would start off with a normal liver, which is represented here with that red, brownish, pinky liver. And then as time goes on, if it turns into chronic hepatitis, it's represented with this yellow liver, because the cells start to not function properly. And then as time goes on, the liver cells could get more and more damaged, and then they could turn into cirrhosis, which is scarring of the liver. And then from then on, a small percentage of people could develop liver cancer or end-stage liver disease. The good news, however, is that the livers are really good at, it's an organ that regenerates really well, pretty much like our skin. So if it's caught somewhere between the normal liver stage and the beginnings of cirrhosis stage, if you start looking after yourself, if you start trying to lead a healthier life, not drinking alcohol, you know, follow the doctor's instructions, and if it's hepatitis B, get monitored. If it's hepatitis C, get cured. You can actually revert back to a normal liver. You can actually, reverse and regenerate into a healthier liver. So the time frame that it takes to get from a healthy liver to a liver with cirrhosis would usually be 15 to 30 years if somebody had viral hepatitis, or never. So never could be, if you got treated and you got cured, or if you had hepatitis B, if you started taking really good care of yourself so that your liver wouldn't continue to get damaged. However, if somebody is using a lot of alcohol and drugs every day, and then instead of 15 or 30 years, this could accelerate, say, 5 or 7 years or so. So our lifestyle and, how we eat and drink and just how we look after ourselves, it's really important for our liver health. And now we'll go on to the ABCs of hepatitis. So hepatitis A is transmitted through poo. So it's fecal to oral transmission. And you can see, I don't know if you can see this, the screen's big enough, you can see this picture here, just how easy it is to transmit to a new host if somebody has hepatitis. The easiest thing is if somebody has hepatitis A, they go to the toilet, they don't wash their hands, and then they go out and they start touching things like a doorknob or things in the kitchen, and if somebody else touches all these things and their hand makes its way to their mouth, it will transmit to a new host. So with that in mind, it's really easy to prevent just by hand washing, okay, with soap and running water. Hand sanitizers are better than nothing, but it won't do the job as well as soap and running water in the case of hepatitis A. It's also preventable with a vaccine. So it's 2 vaccines within 6 months. Now, if somebody did get hepatitis A, the symptoms would be, it would be an acute, intense illness. And the symptoms are very much like a food poisoning. So like a really bad bout of gastro, and it's really severe. Like usually people can't, get out of bed. There's tons of nausea, vomiting, and diarrhea. And it's pretty severe. You'd have the virus inside you for 2 months. The symptoms wouldn't last that long. So generally they can last anywhere between 1 week and 6 weeks. But then after 2 months, the body eliminates it on its own, and then there's 100% clearance rate. Everybody gets cleared and cured, and you'd be immune for the rest of your life. So that's hepatitis A. Hepatitis B is transmitted through blood, sexual fluids. And the most common mode of transmission around the world is actually from mother to child. So it's through being born, basically. It is preventable with a vaccine. It's 3 vaccines within 6 months. And if somebody does get hepatitis B, they would get, firstly, acute symptoms, which is not as strong as hepatitis A, so it's like a mild gastro, and then the symptoms would disappear, and then 6 months later, either your immune system has kicked in and you would be cleared of hepatitis B, or it doesn't, and then this means you would have chronic hepatitis B, which just means you'd have it for the rest of your life. So if somebody does have chronic hepatitis B, they would have to go to the doctor every 6 months and get monitored. If your viral levels go high, you would get given antivirals and also lead a very healthy lifestyle so that the liver doesn't continue to get damaged. So with regards to clearance and immunity, 95% of people will actually get cleared naturally. And however, there's no cure. But if you are cleared naturally or through the vaccine, you'd be immune for life. And a really interesting thing to note is that the virus can live outside of the body for at least 7 days, which is a pretty long time. Okay, now we jump on to hepatitis C. But hepatitis C is transmitted through blood. There's no vaccine for it. And if somebody gets hepatitis C, firstly, they would get acute symptoms, which start about 90 days after infection. And the symptoms are usually being very tired. After 90 days, you would get symptoms that are a bit like you're very tired and it's a bit like a mild flu. So you're very tired and you also have some muscle aches and some fever and things like that. So once again, it's really easy to misdiagnose because, it's not very telling of hepatitis. And then after that, the symptoms would disappear. And then within 6 months, you can either clear of it naturally, or if not, just like with hepatitis B, you would go on to have chronic hepatitis C. So people that are living with chronic hepatitis C, usually their main symptom for a long time is being really tired and a bit depressed because of the tiredness and the brain fog. So 25% of people will clear of it within 6 months, But if not, there's treatment now, and the treatment is a cure. However, if you do either get cured of hepatitis C or you clear it naturally, there's no immunity. So if somebody continues to engage in risky behavior, they can get hepatitis C again and again. And another interesting thing to note is that the virus can live outside of the body on surfaces for up to 3 weeks and in syringes for up to 63 days, which is a really long time, even compared to hepatitis B. And now we'll just go into the treatment. So what there used to exist before as treatment for hepatitis C, this is before the year 2016. There used to be interferon injections, which is basically a form of chemotherapy. The treatment would last usually a year. The side effects were so harsh, it was like having chemotherapy. People would be out of action for a year. And the problem is that there was only half a chance of getting cured. So that was pretty drastic in the past, trying to get cured of hepatitis C. This is the scenario that there was. Now, however, since the year 2016, there's these tablets. These are DAAs, direct-acting antivirals, and the main ones are Epclusa and Mavorite. You take them for 8 to 12 weeks. The side effects are really minimal. So I've been told from people that have had it, that have had these, that if they realize that, maybe there was a tiny bit of nausea or headache, but that if they ate something just before having the tablet, they would have no side effects at all. Basically, you can go through the treatment, breeze through it with no side effects, and 95 to 98% cure rate. Everybody that has completed treatment in the Dean Clinic has got cured through Epclusa or Mavorite. Only one person didn't. They were given this third tablet, which is called Vosevi, and got cured through that. So that's pretty, it's really good. One can get cured from hepatitis C. However, there's about 2/3 of people in Australia that haven't, with hepatitis C, that are living with hepatitis C, that haven't looked for the treatment. And I did mention, the previous treatment, the interferon, because one of the reasons why people don't look for treatment is that maybe they were offered interferon in the past, or their friends knew of it, and they think that, the treatment now is just the same thing. So that's something important to note. There's a ton of other reasons as well, to do with stigma or the price. The price of the tablets are pretty costly, but it does come under the PBS, so the patient doesn't bear the burden of the price. So that shouldn't be a problem either. I'm going to jump on to the next topic, which is discrimination. So in Australia, hepatitis B and C are classed as a disability, and this means that it's illegal to discriminate against anybody affected by the virus. So it doesn't mean that you get payment for it or anything. It's just that it's illegal to be discriminated for having hepatitis B or C. And so people should be treated equally in all areas, including employment and education and so on. The only reasons that people are required to disclose their hepatitis B or C status are in these circumstances. So one of them is if they're donating blood, organs, or sperm, if they're a healthcare worker that do certain surgeries, and these are EPPs, which are exposure-prone procedures. Also, so these would be surgeons and dental surgeons, and maybe, other types of dentistry like implants and things like that. And also the nurses that work very much alongside them. So if you're somebody else, if you're a healthcare worker doing something else, there's no need to declare. Also, if you're a member of the Australian Defence Force, and some health or life insurance policies. And the way to just reduce discrimination in the workplace, which we're not going to get into, all the standard procedures and anything, but just to say quickly, we assume that all blood is potentially infectious, and that way we don't have to discriminate against everybody and against anybody, sorry, and we use our standard precautions at all times. And now we're going to do a comparison of hepatitis and HIV. Okay, so Stephanie, we've got in Australia, the prevalence of people living with a bloodborne virus is this. 2/3 are living with hepatitis B, 24% with hepatitis C, and 10% with HIV, isn't it?
Mm. I remember being quite shocked about that when I first, because I've seen you present quite a few times, and I just know that HIV is, should be talked about and understood a lot better. But in contrast to viral hepatitis, I was like, oh wow, so it's actually a lot less prevalent, and kind of better understood, I think.
Yeah. Well, HIV is always on top of people's minds, and hepatitis is nowhere. But I think also, these figures have come because there's been such amazing advances in medicine to do with HIV. So we're lucky, that's happened.
Yeah, but I think it's also still important to note that there are 28,000 people living with HIV in Australia, because I think a lot of people think that because AIDS is not really a thing anymore in Australia, HIV is not a thing, but that's not the case.
Stephanie is holding our hepatitis ball, by the way.
It's my favorite.
It's a blood drop, isn't it? I don't have one with me. Okay, so with hepatitis, the organ that it infects is the liver, and with HIV?
Yeah, it's the immune system. So that's what it attacks, and without treatment, that's how it develops to the AIDS stage, because your immune system and all your defenses are down. And that's why we also say like AIDS-related or HIV-related illnesses, because they can come about as a result of a really weak immune system that is from untreated HIV, if that makes sense.
What if somebody is under treatment?
It's basically, it kind of, there's many different treatments do many different things, but they kind of interfere with how it's impacting the immune system and like multiplying the cells in very different ways. So it's very different to being untreated.
Okay. So in theory, if somebody is treated, there wouldn't be HIV-related infections anymore?
Yes, ideally the aim is to not like replicate more HIV in the body.
Okay. Right. Let's go on. The transmission. Hepatitis A is transmitted via fecal to oral. And then hepatitis B is through blood and sexual fluids, hepatitis C through blood, and HIV, pass it on to you.
So blood, including menstrual blood, sexual fluids, so that would be like semen or vaginal fluids, anal fluids, and then also breast milk. And similar to, I think it's Hep B, you said, can also be through childbirth as well.
Yeah. And the thing that we have in common here, the common link between hepatitis B, C, and HIV is that it's transmitted through blood. And even though hepatitis and HIV are, viruses that attack very different organs in very different ways and are going to end up with, very different consequences, but they're often grouped together, hepatitis B, C, and HIV, through them being blood-borne viruses.
Mm.
And that's why we often talk about them together. And lastly, second lastly, with regards to pharmacological prevention, there's a vaccine for hepatitis A and B. There's no vaccine for hepatitis C, nor HIV.
Yeah, so no vaccine with HIV. However, the treatment that we've had has come a long way now that it is actually a form of prevention as well. So we have things like PrEP and PEP. So PrEP is pre-exposure prophylaxis. So if someone knew that they were going to be engaging in at-risk behaviour or unprotected sex where there might be a potential HIV transmission, they would take PrEP beforehand. Ideally, there are a few different ways you can take it. You can take it daily for, I think it's like a month, or you can actually take it just 24 hours before, 2 pills, and then 24 hours after, and then again 24 hours after that. So yeah, it works in different ways. It is available for anyone in Australia. And I think it costs around $30 a month if you're doing it like every day, the monthly one. And then PEP, on the other hand, is after a potential exposure. So it kind of acts like emergency contraceptive or the morning after pill. And if someone has been potentially exposed to HIV, they can go to the emergency department and ask for post-exposure prophylaxis, which will, reduce the risk of HIV being transmitted, which is great.
Would they get it there, or do they get given a prescription, or how does it work?
They get given it there. That's my understanding. It should be free. I don't know as much about PEP, to be honest, as PrEP, because it's not as available. But you can get it there on the spot, I believe, from the ED or like a hospital pharmacy as well.
Okay. And would GPs carry this as well?
GPs don't carry PEP, to my understanding. They do. Anyone can prescribe PrEP, but it's a bit different with PEP.
Okay, that's good to know. Because I get asked that.
Yeah.
Quite a bit. Thank you. Okay, so with regards to treatment, so what we saw before was prevention, but with regards to treatment, with hepatitis A, as I said earlier on, it's very much like having food poisoning, a bout of gastro. So you would treat the acute symptoms and wait for it to go. For hepatitis B, if somebody is living with chronic hepatitis B, they need to go to the doctor to get monitored every 6 months and then take medication, when required, and also lead a healthy life in terms of diet and exercise. With regards to hepatitis C, there's medication, which is a cure. And Stephanie can talk about medication for HIV.
So medication for HIV is called ART, which stands for antiretroviral treatment. There are a few different ways that you can take this now. So commonly and historically, it's been pills. At some points there were multiple pills. Now it's just like one a day. There's also actually injectable options now. So people can go in and get an injection every 2 months instead of taking a pill every day. So it's great. Yeah, it's great that people can choose what suits them best. I personally, when I heard about this, was like, why wouldn't anyone not choose the 2 monthly injection? But I think someone actually that we work with mentioned that if you're old and you're taking a bunch of pills anyway every day, it's easy to just add in your HIV treatment as well. But other people like the freedom of getting the injection every 2 months. So it's just what people prefer.
Are there injections widely available?
I believe so, yeah. I think they're becoming more and more popular and pretty available. You do have to meet certain requirements in terms of your viral load and your other health and things like that. But yeah, I believe they're becoming more and more available and popular.
Cool. Okay. We're on the last lap now. We're just going to do 3 really fast true or false questions. So, can hepatitis B be transmitted through sharing a plate of chips with your friends? Okay, that's right. It's false. We didn't talk about the transmission, so that was a bit of a trick question. But no, the hepatitis B and C aren't transmitted through sharing food. Is there a cure for hepatitis C?
And then, I guess
I couldn't hear that properly.
I just put myself on mute, so hopefully that wasn't the sound that you were talking about. But I actually can't remember this one, so I've just voted with the majority.
So yes, there is a cure for hepatitis C. And even though right now there isn't a cure for hepatitis B, there is, wait, I'll just go back to that. There is currently clinical studies. I think they're coming into phase 3 now for treatment to cure hepatitis B. So that's promising. There might be a cure for hepatitis B in the future. The last one is, do acupuncturists have to legally disclose if they're living with hepatitis C? So that's correct. No, they don't. They have extremely strict infection control procedures where it outlines every single movement that they have to do and everything they have to do with each needle, but they don't have to legally disclose. Okay, and that's it. So does anybody have any questions? Which you can either just say out loud or type in here.
I do have a question. I'm not sure if it's going to bump us up in 2 minutes, so hopefully that's not the case. But yeah, I'm just wondering in terms of the clients that I know you wouldn't be the one seeing them personally in at the Dean Clinic, but what is kind of the biggest some of the more stigmatizing experiences that they've had with either people or employers or healthcare professionals? Like what's the most what's the presentation like of people?
Okay, so we have obviously we have patients that come for lots of reasons because we are a GP clinic, not just a hepatitis clinic. But with regards to hepatitis, so hepatitis B, not many doctors can treat it because you have to be an S100 prescriber. So there aren't many of those. But the most stigmatizing thing is with hepatitis C, even though lots of GPs can treat hepatitis C, a lot of GPs will say, oh, we don't do that, or we don't have patients like that, go find another doctor. So we do get a fair amount of patients that come to us because their GPs have said that. Yeah, their GPs have basically said, oh, we don't treat hepatitis C.
That's awful.
Yeah.
All right, I think if we don't have any more questions, we might wrap up. Thank you so much for presenting, Sophia. I'm always learning a lot about this topic. I still can't really remember the difference, but it comes back to me every time I see you present.
The slides I gave you.
Yeah. Cool. If anyone has questions, they're welcome to email me or Sophia. Did you have an evaluation that you wanted people to do?
No, not today.
Okay, cool. Perfect.
That's my email there. It's projects@hepatitiswa.com.au if anybody wants to email me for anything.
Perfect. Thanks so much, everyone.
Okay,
Stop
thank you.
recording now.